Commissioner Dr. Larry Eisenstein. We have Ann DeSimone, who is our Director of Emergency Preparedness and Incident Commander. Deborah Kimmelstein from the Health Department. She's the Director of Communicable Disease Control and the lead investigator on this case. We also have with us Dr. John Sazzo, a member of the Nassau County Board of Health, the medical director of the county's 1K member, is that correct? 1,000 member, and Medical Reserve Corps of Volunteers. So thank you very much for being here. After a thorough investigation, the Nassau County Health Department has been made aware of a potential hepatitis A exposure from a food handler at the 7-Eleven located at 1555 Jerusalem Avenue in North Merrick. The potential window of exposure extends from February 1 through March 6. A protective vaccination could prevent the disease in those exposed between a shorter period of time, between February 24th through March 6th. Anyone who may have been exposed by using the toilet, drinking food, drinking liquids, beverages, eating food from the 7-Eleven might benefit from this protective vaccination. The county is being protective and proactive by offering this free vaccination to those who may have been at risk. These findings are the culmination of the great work done by our Department of Health, health inspectors, and disease investigators. And I want to thank you for working to ensure the safety and well-being of our county's residents. Legislator McKevitt, would you like to say a couple of words?
Sure, yes. Listen, I'd just like to first of all thank the County Executive and Department of Health for the proactive actions they're taking. And obviously the most important thing we want to do is make sure we get to those members of the public who may have gone to 7-Eleven. It's right near the corner of Merrick Avenue and Jerusalem Avenue, right north of the Sergeant State Parkway, to make sure they possibly get the vaccination to prevent any symptoms or illness at this point. So that's our goal at this point. Thank you.
I'm going to turn it over now to Commissioner Eisenstein.
Thank you. Good afternoon. Thank you, County Executive Curran, and thank you to the press for helping us get this message out. We want our residents to be aware of this potential exposure. I want to be clear that the risk is low. This is not a cause for panic, but people should take precautions and protect their health. We've opened these free vaccination events. The first one is going to be Sunday afternoon from noon to 4 p.m. at Nassau County Community College. The CCB building, we've confirmed. I want to thank the State Health Department for helping us secure thousands of doses of vaccine, which we'll have ready. I want to thank the medical director of our Medical Reserve Corps, Dr. John Sazzo. Our Medical Reserve Corps is a wonderful group of medical volunteers who we train all year for events like this, and they're ready to go. And a wonderful job was done by our disease investigation team. And thank you to Ann, our preparedness director. I want to be clear that the window that this vaccination will be protective ranges only from February 24th to March 6th. So for the people that might have been exposed before that, in the window of February 1st to February 23rd, we urge them to watch for symptoms, discuss the situation with their primary care physician should they have any concerns. While vaccination won't help them from this exposure, it might prevent future exposures. And I am happy to say that for a little over 20 years now, hepatitis A has been one of the recommended vaccines, not mandated, but one of the recommended vaccines. And so many of our children and people up to their early 20s have received it just as a routine precaution. But we're able to answer questions. We're able to resolve any difficulties regarding whether somebody should or shouldn't be vaccinated. The first event will be this Sunday. The second event will be Monday afternoon from 1 to 6 o'clock at the Nassau County Department of Health headquarters at 200 County Seat Drive here in Mineola. And I'm happy to take any further questions. And once again, thank the county and State Health Department for their incredible support with this. Thank you. So hepatitis A is one of those mandatory reportable diseases. There's approximately about 80 of them, and we were reported by a health provider who made the diagnosis, as is the law for them to report to us.
How many people may have been exposed?
It's difficult to assess because one of the things we do when we do a thorough investigation, just walking in the store, for example, and buying lottery tickets, we would not consider that risk. So we know that this is a busy 7-Eleven. We know that a lot of people use it. It's located near the entrance to a highway. It's hard to assess exactly how much contact the food worker had with the food or how many people used the restroom, which could present a risk. But we have thousands of doses, and we're prepared for any number of people that feel they might have been exposed, but there's no scientific way to know exactly how many people are potentially at risk.
Do you have any information on the food handler? Is it a man, woman, and what his or her condition is at this point?
We typically don't talk about cases, and from the health department's perspective, we're comfortable that the food handler is getting appropriate medical care, and we're really focusing on the people around the food handler, so I don't have that information for you, Greg. I'm sorry. So whenever we have a situation of a food handler who could be potentially transmitting disease, we do an exclusion order. They are not allowed to work until they meet the criteria that they're clearly no longer contagious. And those criteria vary by the disease, but in this case, yes, an exclusion order has been sent in. So this person is not actively working.
And what are some symptoms that people should look out for?
Do you want to take this, Debbie, or you want me to? I'm going to invite Debbie up because she's our lead disease control investigator and has done an amazing job sorting through the facts and determining the risk here, and very proud of her work. So, Debbie.
Hi. Actually, hepatitis A is like the other hepatitises in that the symptoms can be vague. So in the beginning, it's like fever, headache, malaise. You get sometimes abdominal discomfort. Sometimes you get nausea, loss of appetite, and occasionally you get diarrhea. Towards the end, when you get jaundice, that's usually at the last week, and you're becoming less infectious as soon as you develop that symptom.
How does it spread?
Go ahead.
Hepatitis A can be spread person to person. The mode of transmission is this fecal-oral transmission. So you get a small amount of feces from a contaminated individual on an object or on food that you consume.
So I just want to add.
So basically it presents as where you might think you have something else.
Like a regular virus that you might normally.
Yes, okay.
Symptoms are similar.
One of the challenges in diagnosing is it's one of those diseases where symptoms can vary greatly. Some people are barely impacted but are still contagious, and others are really sick. And I think, going back to the question, Greg, on how it's transmitted, every time you go into a restaurant, you see those wash your hands signs, and this is a classic example where hand washing is truly a vital, potentially life-saving measure. Everybody's got to use the bathroom, but good hand washing can prevent disease transmission.
Did somebody contract it? Is that why the investigation came out?
No. We were informed that one of the employees there has the disease, so there's the potential for transmission. We don't know that any case has been transmitted, and the actions that we're taking are, if there is a brewing case developing, our vaccine can prevent it from happening. So that's why we're doing this, but we have no secondary cases at this time.
If someone has the vaccine but feels that they may have been exposed, do they get another dose of it?
Absolutely not. If somebody's completed the vaccine, which is 2 doses of vaccine during their lifetime more than 6 months apart, they are protected. If somebody likewise has had hepatitis A before, and it has happened, people have gotten it from traveling or locally or through other ways, they also are not at risk. So one of the things if somebody comes to our vaccine event, we're going to ask them the questions. Are you vaccinated? If somebody's child has been vaccinated and completed the series, they're not we're not going to vaccinate them. They're at no added risk.
Do you have any indication where this food handler got hepatitis A?
There's no way to know that unless they came from a common source. Hepatitis A is not entirely rare, but it can be from food sources, it can be from travel, it can be, because of the mode that it's transmitted, anywhere there are people, it could potentially be transmitted. And we preach immunization and the vital need for people to be immunized. And even though this is not one of those school-required immunizations, who wants hepatitis A? So the vaccine is out there, and anybody can get it. And We urge anybody in the public who feels, especially if you're going to travel abroad, speak to your primary care doctor about getting this vaccine. It's recommended and it's available and it's very highly effective.
Talk about the gap in time from when somebody could have possibly contracted it to when the vaccine would be effective.
Sure.
You had two different dates.
Yes.
Like date ranges there.
I'm sorry, I'm not sure I understand the question. We have to vaccinate you within 2 weeks of your exposure. That's the benchmark. I can do it sooner. I can't do it. The CDC recommends up to 14 days after the exposure. Am I answering your question? All right, thank you.
But people might have been exposed before that, and what we're suggesting is they're vigilant and they speak with their healthcare provider, but our vaccine event isn't going to impact whether if they were exposed, what their outcome would be.
Before you walk away, say and spell your name and your title, please.
Me?
Yes.
Dr. Lawrence Eisenstein, Lawrence, Eisenstein. I am the Commissioner of Health in Nassau County.
You know, and let's just use this opportunity as a reminder to everyone, please wash your hands. You know, this is a preventable contagion. So everyone just take care of yourselves, listen to your mother, and wash your hands. Thank you.
Thank you.
Any,
Can we ask off topic? Maybe I'll come and do it to you, yeah. Okay.
Thank you.